morning, everyone. Dr. Deborah Dupree here, Mindset Doc. Happy Monday with Felicia Amenta from the JPA. And so we're delighted to have you with us today. We've got some hot topics for things going on these days, and things continue to emerge, don't they? And so I think I had 8 IPMs last week.
Wow.
At school opening up and things like that. And so, people, employees are having concerns and challenges with what's going on. And so very delighted to have you with me today again, Felicia. So it was good timing, right?
Yeah, it's my pleasure. It has been really busy with everybody reopening and hybrid and some open, for 5 days a week. There's a lot going on.
Mm-hmm. Absolutely. Absolutely. Looks like we're still getting a couple people coming in. So again, for those of you who have been with us, we do this once a month, and Felicia and I meet ahead of time to sort of explore what kinds of questions are people giving to us, and what seem to be the primary concerns, and try to bring some answers to you. And so welcome, everyone. Just a reminder, we are recording this so that the recording will be sent out to those of you who have registered. And you can certainly go ahead and register for future Q&A sessions, always Mondays at 11 a.m. for about 45 minutes. And our goal is to open it up for questions. And then two, you can also, we'll open up for questions before we end, but also feel free to put questions into the chat box so that as we're talking around different topics that we're able to do that as well. Okay, so let me just see here. Okay, very good. Okay, so here we go. Well, Felicia, a lot has been happening. And I think one of the first things that we wanted to talk about this morning was the implications or are the implications of AB 95, given our continually changing COVID-19 atmosphere, but the fact that they went retroactive to January 1st. And so please elaborate on that for our viewers and listeners.
Well, in their infinite wisdom, when they passed Senate Bill 95, it went into effect on 3/29/21. But you're right, because it was retroactive to 1/1/21, we already had some school districts that had extended temporary disability payments and some other payments for some of the individuals that meet the 7 qualifying reasons under the new Senate bill. Basically, that all California employers must provide 80 hours of paid COVID-19 supplemental sick leave. And this is a new bank. And this law is going to remain in effect until 9/30/21. And we have had a lot of questions about, well, wait a minute, if they had 40 hours and this is up to 80 hours, the new law, but if they already had COVID supplemental sick leave in 2020, they don't get a new 80 hours. And I'm like, yes, this is a new 80 hours. This is a new bank. We start over. This is not extending AB 1867 and the FFCRA, which expired 12/31. This is a new requirement, a new bank of available sick leave, even if you paid in 2020. And this applies to those 7 qualifying reasons and employees who are not able to work or to telework due to those 7 qualifying reasons. And it also kind of works in conjunction with the 𝐀𝐠𝐢𝐥𝐞 emergency temporary standard pay policy too, just to confuse you even more.
It can be confusing keeping track, that's for sure. And so, when you talk about the 7 qualifying reasons, what other qualifications are required?
They added some qualifications. There were 5 qualifications from my understanding under FFCRA, and many of you on the call know what those were. They were people that were quarantined, people that had COVID, people that were sent home from work because they tested positive. There were a lot of reasons around testing and contact tracing. They added some qualifications now because of the vaccine is available now. So people that have the vaccine, that is another qualifying reason if they need time off or sick leave for that, and people that have side effects from the vaccine. So because of the vaccination, they expanded it a little bit from the prior FFCRA qualifying events. And then I sent out a supplemental notice because if you have an employee who's filed a work comp claim for COVID, we have had a couple of employees who Athens, our TPA, paid workers' comp TD 2/3 voucher to the district. But now that we have the new law in effect on March 29th, my recommendation has been, because what the law does say is that sick leave is to be used before TD work comp comes into play. And because we send the money back and forth internally, it's pretty easy to fix. And so what I'm advising the school district to do is let's credit back the TD, put that back on the file, and let's pay the under the 80 hours of supplemental sick leave under SB 95. And that's going to be my recommendations for anybody that's filing a work comp claim going forward for COVID, is that we utilize SB 95 leave first. And when that sick leave is used and exhausted, then we go to the work comp TD 2/3, because there's been a lot of questions back and forth with confusion about how SB 95 works with the work comp laws.
Okay. And so if I'm understanding you correctly, then just make sure our viewers and listeners understand this too, is that regardless, so it's not just COVID related absenteeism, right? It's any workers' comp claim, and you're putting the 95.
No, SB 95 is only sick leave. The 80 hours is only for COVID-19 related, and the 7 qualifying reasons, which all have to do with COVID-19.
Okay.
Because normally in workers' comp, we have a complicated system of paying time off, but in normal rules, we do not use we don't use sick leave in lieu of, we use sick leave to sometimes keep them whole. But this is sick leave in lieu of. So it's very different, this particular law.
Okay.
And FFCRA worked the same too. You used that before you used work comp TD.
Yep. Okay, great. Have there been any other unique challenges aside from just understanding these differing timelines and so forth?
There was the problem was they put it out on 3/29, and then they said it's effective immediately, and you have 10-day grace period to comply. And then they put all of these parameters. They capped it at $511 per day, a maximum of $5,110. They indicated what employees qualified, full-time employees, and then the way that part-time employees qualify. And they had a very complicated system of calculation for that. And then they also required notification to your employees, all employees, about this leave. And so all of this had to be, all of payroll and HR had to get up to speed on SB 95, put out their notices. I know SDCOE, the day after I sent them the information on the law, they put out the notice, like they did it immediately and notified all of our employees, got a notification about this leave, because you need to request it, right? So if you don't know about it, you can't request it. It's available upon request. That can be made, I think, verbally or in writing by the employee. So there were all kinds of training and notices that needed to be done, like all things with COVID, that had very little time, right? 10 days grace period, and to go back. All payroll have to go back to January 1 of 2021, of the beginning of this year, and look at anybody that might have qualified for this leave and make sure that you didn't dock their own leave for this time. So this is a little bit of a burden, right? Because this is a look back, similar to what we had to do with when SB 1159 went into effect. And they said we only had 3 days to put into the Athens portal all of our employees that tested positive. Well, all the districts had spreadsheets and information, but we had to go back to the very beginning of COVID and report claims from March all the way forward. So that was onerous too. They gave us more time. We had like 30 days to do this. They only gave employers like 10 days to comply with this.
Well, they probably figured employers had already been challenged enough that they should be able to turn it around, really, right?
Right, maybe. And you know what happens, there's just a slew of questions every time they put something new, because sometimes the guidance doesn't have a lot of detail. It doesn't drill down into all the little details. And so, then we do our best to get expert answers, to the questions.
Okay, so and again, this stays in effect through September 30th, so we'll see us into the start of the new school year, and we'll have a much better feel, hopefully by then, as far as where this whole pandemic is going, right?
Correct. Yes, I think so.
Well, that sort of leads over to our second key area that we want to discuss today, as far as some of the new EEOC guidelines, and what it means regarding the interactive process for employers and employees. And I know both you and I attended a pretty informative workshop last week, and we've got some others coming up. So for our viewers and listeners, do note that. Both Felicia and I are actively following these kinds of developments. And so it'll be interesting to see what's out there, in the forthcoming workshops, if anything is really different from what we've learned so far. And I know one of the things I was looking for it before we got on, there is a link to an EEOC webinar that is available on YouTube. And so I'll either provide that during the course of our meeting today, or we'll include that in the release of the recording in a couple of days, so that you've got that, so all of our viewers and listeners have that as far as a resource to study a little bit further detail. But I'd like to, get your takeaways from that workshop we did last week. It was very informative. And what would you say the biggest message from EEOC is?
I thought there were a few things that I thought were so key in that, was that that overall the Americans with Disabilities Act and failure to accommodate litigation remains one of the highest risks that employers have based on litigation figures at the EEOC. I thought that was really interesting. And I took the takeaways that the three areas where they were going to be really looking at employer processes were: one, telecommuting, right? And offering that as an accommodation. And number two, reassignment. And reassignment can include demotion, which, a lot of employers don't think about demotion if another reasonable accommodation can't be met. And number three, they're going to be looking at consistent practices and return work policies that employers and school districts have in place. And four, failure to accommodate. And that there was a very interesting example that they gave of an employer who, this was a California case, right? And they were fined $2 million by the EEOC because their policy was really out of date. What they told the employee was that in order to come back to work, they needed to be able to do 100% of their job duties, which, as we all know, is in direct violation of a policy that you can have with regards to disabled individuals. And then I thought the whole EEOC guidance on vaccines that they put out on December 16th, 20, with COVID-19 being considered a direct threat, was really interesting. The new guidance put out in December, that employers can mandate vaccination. They do not have to, and they need to be careful if they do, meaning as far as religious exemptions and health exemptions, but that they can mandate vaccination for employees to return to work. That doesn't mean you can terminate employees, but it means that you can require it in order for them to come to work. So I thought some of those areas were of great interest.
Yeah, absolutely. And I know one of the, in addition to these things, I think one of the key takeaways that was repeated numerous times, and we talked about this, is flexibility, flexibility, and flexibility. Yeah, yeah. And so, really, really promoting, that during, this COVID-19 period of time, that, is unforeseeable, but it seems to be getting better and better. That I know in all the IPMs, it's like, what we're talking about in terms of accommodation is temporary in nature. And we need to expand our mindset as far as being creative and looking at options we might not normally have looked at, like telecommuting longer from home than usual. And so to really think outside the box, because what's happening now will be and can be very different in the next school year. And that's the other thing too, is that by being flexible now, being very clear that these are temporary accommodations, they're not intended to be long-term accommodations, and anything that may turn into long-term accommodation may need to be reevaluated at some point in the future.
I thought one of the examples that they used was very helpful. They had a senior administrator who asked for an accommodation to telework 1 day per week due to some anxiety and depression that this individual was experiencing because of COVID. And the employer said, no, you need to be in person, 5 days a week, and we can't accommodate this. It's a hardship. And the EEOC, that was a lawsuit, and obviously it was found on against the employer. And some of the comments, the readouts from EEOC was simply saying in-person work is essential doesn't necessarily make it so. You have to prove that up. And telework, with all the supplemental technology and everything that we have now, has increased. Due to the pandemic and also outside of the pandemic. It was increasing a little bit even before the pandemic, but then it really shot up after the pandemic. And they were saying reassignment or can be a reasonable accommodation. Demotion when nothing else can be found can be a reasonable accommodation. Leave can be a reasonable accommodation. So these are things that from that flexibility that we need to be looking at, right?
Yeah, absolutely. And just to be clear is that, things like a demotion, that's always been part of the accommodation.
Even before COVID, right?
Yeah, yeah. And that's one thing that, when we talk about, workers' comp, of course, workers' comp has a threshold as to, how much of a demotion or loss of pay can someone can be offered before it gives employees the right to decline that offer. ADA doesn't have that kind of threshold. And the way I've always approached it throughout my years of doing this is that if it means continuing to work, the ADA, EEOC wants to see people continuing to work. And so, yeah, it may mean a demotion or a reduction in pay. And that's what you have to evaluate then. But if you turn down a reduction in pay or demotion, then the employer has fulfilled their obligation to accommodate. You're the one that's declining the opportunity to be accommodated. Yeah. So that's
I thought it was so interesting when they talked about that they do want employers that preferential treatment can be extended as necessary to provide a disabled employee with the same opportunities as their non-disabled colleagues. I thought that comment from the EEOC was very interesting too. Preferential treatment can be extended to even the playing field, so to speak.
Yeah, yeah, yeah. Well, in that regard, that sort of ties directly right into the education code's 39-month. That's a very extended preferential consideration for people with medical conditions. And I emphasize that whenever I'm talking to school employees, that's a benefit that doesn't exist anywhere else that I know of. It may be in other states in education, but other public agencies and other private sectors, no, not at all.
Right.
Felicia, we do have a comment in the chat box that, aren't all people in education now considered essential workers? A comment on that.
Well, I think when they're talking about, are we talking about all people returning to in-person instruction? Is that, and being an essential worker from that?
Well, maybe Dora put the question out there, so maybe she can elaborate. Dora, if you want to.
Yeah, Dora, go ahead and tell us what your thoughts are.
Yeah.
Yeah, well, back in July, when we all were asked to come back to work, we were told we didn't have a choice. We were essential workers. So now when you're in the interactive process meeting, if you have an employee, like you indicated, you have that one employee that wanted to stay off for the 1 day a week, and they were told, no, you have to come back. I mean, isn't that person an essential worker if they're in education? And how do you accommodate that if we're an essential worker? Does that make sense?
Mm-hmm. So Deborah, do you want to approach that from the ADA's perspective of a person with a disability?
Yeah, one of the, as I said earlier, the one thing that's really being emphasized is flexibility. And so even though everyone was ordered back to work, shall we say, again, if there was an underlying condition or some other factors medically related that precluded the person from returning to work, then again, a temporary accommodation during this time would be afforded, even though everybody else may be back. And so then what we've been doing around these kinds of cases is, just because they all frontline workers were back to work, we really had to take a look at how essential was being back on site to this position. And the efforts then are always, to restore people to be at work, stay at work, and perform the work. And so if, the goal, so I'll give you a couple of examples too of recent IPMs that, again, just because everyone's back, we have to take a look at a case-by-case basis, and and really evaluate, well, what work can be performed from home and what work must be performed on site. And so one situation just last week was a teacher wanted to remain at home because her two high school students are still learning from home, have no other supervision while working by attending classes from home. And given their age, 15 and 16, she was just concerned that that was way too long for them to go unsupervised, 5 days a week. And then it turned out that she did have an underlying condition that had not been previously reported, and she was in treatment for that. What we were able to work out is that because of the school day going on right now, which basic classroom instruction was going on from 8 a.m. to 12:40, and then teachers were still working until 3 o'clock, the standard school day, but they were doing meetings, parent follow-up, planning for the next stage, curriculum, things like that. That was more flexible. So we worked out a deal then where she is coming back to work 5 days a week in the morning for the classroom instruction, so she can avail herself of all the technology in the classroom that she doesn't have at home. But then she's going to be working from home in the afternoons, but we're going to increase that too. We're starting out with 1 day and then 2 days and then 3 days, so she gets back to 5 days. Because the importance there for underlying condition is that it's important to reacclimate you to the school environment too, and the thing about social support. The isolation was actually potentially feeding into her condition as well. So that's what we were able to work out. So again, the ADA would stress flexibility, even if it's considered an essential worker, and then to see again the accommodation then is, how do we help you get back to work? And so we worked out a plan of action for that. And again, only for this school year. We'll have to reconsider what's happening next year. But she also anticipates her treatment to be done, and she feels that she'll be better off and her kids will be back in school. So that's the way the ADA would look at it, is, okay, they might have a need to work at home, but then how do we transition them back as part of the accommodation process? Does that help, Dora?
Yeah, thank you.
Yeah. And there are a couple others too, where again, taking a look at, that case-by-case basis becomes so imperative under the ADA. And again, what is the employee doing? What must be performed? So there's been a lot of variations of that kind of model I just talked about as far as a transition period. And even if somebody has a fear of going back to work and not being vaccinated yet, et cetera, is that, again, transitioning the people back into work, particularly if there is anxiety, for example, gives them a chance to manage their anxiety and not get overwhelmed with just returning to work, full on right away. And that's where the flexibility and creativity have really been coming into play.
And I have seen, and I know Deborah, you have seen too, I have seen with districts doing IPMs on their own or utilizing your services, shorter time frames, both on the work comp side for industrial injuries that are requiring accommodation and on the non-industrial side that are requiring accommodation due to a variety of things that the pandemic has created or that COVID has created, shorter periods of time that we're going to provide the accommodation and then review it in the fall or review it again. Whereas pre-pandemic, we didn't do that so much. We sort of did our accommodation and this is forever and this is what we're doing. But now we've been doing like end of the school year, or we'll reassess in the fall because there's so many moving parts. It's hard to make a longer term prediction. What I thought was so interesting too is the changes in having COVID determined by the EOC as a direct threat, the changes that allowed as far as our measuring body temperature and COVID-19 testing, which is required, at the county office, we're mandatorily tested every 2 months, and requiring a doctor's note for fitness for duty or proof that they're free from COVID, that they can return to work. These are things that are considered before by the EEOC as private medical examinations, and no employers were able to do these things. So COVID has changed everything. And from my understanding of the EEOC, the vaccine is not going to be considered a medical examination either. And then employers can mandate the vaccination. They can require proof of a vaccination, not ask why if they weren't vaccinated. And they do still have confidentiality requirements for those pieces of information. And if an employee doesn't want to answer any questions, if the vaccine is voluntary, then if they don't want to answer any questions about the vaccine, they don't have to do that either.
Yeah, I think there's, not to get too deep into the vaccination thing, because I think, I hear what it says, okay, and I heard, I've been to the workshops, but it's like, how is this really going to carry out? You can mandate it, but you're not required to, and so I know in a situation with another school district, we've been working with an employee and trying to help her get back to work. She was in a department that actually has remained on site the entire time because of the nature of the work. And all other employees, they had a limited staff during the initial period of COVID. And then, employees did come back to on site in July. And it was right about that time this employee developed her condition and has been in treatment for it. And at first they were able to accommodate her by working from home because they had a backlog of work that needed to be done, but then it expired December 31st. And so then we met again and there was no available work. We were trying to provide her with an isolated work area, but that still didn't work. The space just wasn't available. And so, she continued being at home, but was not working. So she was given a leave of absence then. We met recently because she expected her condition to improve in March when it still isn't. She still needs a couple more months. And so under EEO guidelines again, is that even though you might have a fixed policy, like say, no temporary leaves of absence longer than 6 months, for example. If somebody says, I only need 30 or 60 more days and it's a defined fixed period of time, the EEOC has said that that's permissible to extend that past your usual policy. But if it's undefined and indefinite, like, well, I don't know when I can come back to work, that is not a reasonable accommodation. It's got to be short-term and defined, and usually that 30 to 60 days has been used. We've even used it to 90 days just because, with this whole COVID thing, it was like, well, again, be flexible. And so we just met again, and now she's of age, but she cannot take the vaccination because there's an ingredient in it that she has an adverse reaction to, and they're concerned that it would adversely impact her given her underlying condition. So at this point, it is if she's not able to resume working by June, then then the accommodation process will most likely end at that point, and we'll take the next steps to exit her out.
From an
Because-
HR policy. Well, and I noticed the cautions that they said employers must take care of no disparate treatment of employees that don't take vaccination, or you could get a hostile work environment claim. And that additionally, employers must show that an unvaccinated employee poses a direct threat due to substantial harm to health and safety of that individual or others that can't be eliminated by the reasonable accommodation. So I guess there's that question again of have an IPM, when in doubt on all of these issues, meet either by yourselves or utilizing your services, to have that discussion about what are the things we could do. Could it be telecommuting? Could it be a reassignment? Could it be a demotion? Could it be leave? What could it be? You know, what could we do? So I guess it's expanding your mind. And I have seen a lot of our districts getting really creative. I noticed that when you go to our office, you know, you have to check in and you have your temperature taken and you have symptom questionnaire asked of you. And I noticed a lot of our other departments, outdoor ed is there, you know, I know some of the folks. And so you're right, they've utilized some of them in very creative ways and putting them in different positions. So.
Yeah. Well, again, as we said at the outset of this meeting, you know, flexibility and creativity are really key. And so, again, EEOC main interest is helping people be at work, stay at work, and perform the work. And the reason why is, you know, the implications for this. I did quite a bit of research last year as far as just these overarching laws and agencies and so forth. The biggest thing, EEOC's perspective, is keeping people at work so that they can avoid going out on disability, you know, which is a huge drain on resources at another level federally.
Mm-hmm.
But also the studies, the implications for employees and the lives of their families drastically changes as far as quality of living, cost of living.
Mm-hmm.
All of this goes down when somebody is on disability, long-term disability benefits like Social Security disability income, as opposed to when they are gainfully employed. So again, you've got some competing ideologies at the federal level on this, but again, the goal is to keep people being productive members of the economy, quite frankly.
Mm-hmm.
Yeah.
Right. I read that somewhere last week that the determinant factors, if somebody is not employed, that's like smoking 20 packs a day, meaning that also is very damaging to your health. Like our people that are off work, even on workers' comp, that during the time that you're out of work, whether you're having a surgery or you're having medical treatment or you can't be accommodated, you know, for a variety of reasons, that is also bad for your health in other ways, right?
Yeah. Yes. Yes. And we know that, you know, things like anxiety and depression have risen significantly during this COVID time. And so, and not that it wasn't there before, but the prevalence of it is much more evident and apparent in return to work issues. And so, again, you know, we've all experienced working from home during this last year, and I've just did some workshops for another county office of education, and they were just so thrilled to be able to see each other again on Zoom, because not everybody was working in the same area and stuff, and many talked about the social isolation that has happened as a result of COVID. So there's a real push there as far as the mental health of our employees, as far as getting them back to work, and that's again what the ADA is looking at as well. Yes, yes. Well, I know there's one more topic that we wanted to cover, and then I do want to open it up if people want to unmute themselves and ask some questions, and then we'll sort of summarize some key talking points here. But you and I have talked about the implications for drug testing and in the emerging COVID-19 world, and because there are a lot of new hires going on, and because as people have chosen to retire, a lot of retirements this year, and then just different jobs being needed. So what do you see happening? And then the interplay for the interactive process, because a lot of people don't realize this applies to candidates for employment also.
So I manage the pre-placement physical program and other services, and it's sort of a menu of services. So I will say that the majority of our school district and charter schools do pre-placement physicals for their candidates post-offer pre-employment. That's when we do it. And the majority, not all of them do, but most of them do. And then I will say that most of them do drug testing, not all of them, but most of them, their HR policies and their board policies do require drug testing. Our particular drug testing for non-DOT is identical to the DOT drug screen. It's a 5-panel drug screen, and we test for THC, opiates, PCP, cocaine, and amphetamines. And in the last few months, I have gotten more questions about this program than in the entire 13 years I've worked here. So the one thing anecdotally I can say is that our positive results are up for opioids, for cocaine, for THC, kind of across the board. And also our negative dilutes are up. Negative dilutes is where you either drank a whole bunch of water and the test results are not clear, or you were doing something to interfere with the test. We don't, in our program, allow retesting. If you test positive, you've already gone through an interview with the medical review officer to talk about any medical or disability reasons that you may have tested positive, including prescription medication that would change that to a negative, right? If you had a medical or a disability. And also, we've had an increase in negative dilutes. We do allow one retest on negative dilutes. And if you test negative dilute again, then we defer to HR board policies for the school districts on what they do there. We have had a few questions also where the medical review officer has called and tried to talk to the candidate because they need to report out to the district so they can make, we're doing a lot of the districts are doing a lot of hiring right now in a very rush environment. And sometimes the medical review officer misses the candidate. And so they don't get an opportunity to have that conversation. So they report the drug test out as positive. And then the candidate does get with the medical review officer and then it gets switched to negative. And a lot of the districts are like, what do we do? Is that positive or negative? Most of the districts, if that happens and it's due to no fault, it's just a communication snafu, usually they do go ahead and hire that person, but I defer to each individual school district's HR board policies. You do want to make sure that your board policies are clear on what your drug testing program is. Not all of our members require mandate drug testing. If you're going to do pre-placement physicals, you have to be consistent, and drug testing, you have to do it for all of the employees in that class that you're testing. So, but those are some of the trends that we're seeing, which I find so interesting because it's happening more now than at any other time. So I don't know if maybe you can speak to what's happening with mental health and drugs and alcohol because
Yeah. Well, that is something, with more hiring going on and people having been out of work, we not only do we see anxiety and depression up, but yes, I mean, the alcohol and drug use has definitely gone up as well. And so increasing the incidences of alcoholism, of people getting treated for excessive drinking. And then also, whether it's, whatever kind of recreational drug use is involved, people have had time on their hands and no place to go. And so this has definitely sort of become its own pandemic within a pandemic, so to speak. And so, yeah. And so one of the things like I mentioned is that, a lot of employers and particularly my experience with school districts have not been using the interactive process around these kinds of issues. And yet some have. In each of the situations you've talked about, where either someone didn't pass a pre-placement physical in accordance with the stated demands of the job, well, again, what's that about, and could their accommodations be made available? And sometimes we have been able to make accommodations, and sometimes not. And so, but in a way, it's a way for employers to protect their liability, because the EEOC is pretty stringent about that. There are court cases out there that, again, the failure to engage and the in the interactive process is a liability just as failure to accommodate. And so it's really important that employers show their capacity or their efforts in doing that. Whether again it's me or just done internally, have that meeting with the applicant to verify. I've also had a couple of cases where people didn't pass the drug testing. Well, what's that about? What kind of medication is this? How does this impact performance of the essential functions of the job? And so that can be complicated. I also have had a situation of where an employee was a candidate was hired, brought on board to the orientation, and what she stated in her application and how she showed up with the onboarding process were almost like, is this the same person? She showed up with this long list of accommodations she needed, with a service dog, and yet her job was in an after-school program of where she needed to be actively engaged with the children. It's like she had stability issues, balance issues, all this kind of stuff. And so what was interesting is that we did do the interactive process, and I said, well, you have a responsibility. If you apply for a job and you review the job description, what you did, and you feel that there are things that you cannot do, you can ask for accommodation. But she didn't. And so then it was really, she lied on her application because she literally didn't, check that she did not have any need for accommodation. It turned out that, basically it worked out well. I was able to educate the candidate, protecting the employer's liability because of how it was handled. But gave her some resources that where she could get more information and guidance and how to apply for jobs with her disability, and not go through this kind of process as it got contentious. But it all worked out. She was not hired. She was not brought on because she clearly could not perform the essential functions, and so that's what the interactive process was able to demonstrate.
Right. And I agree with you. I do get calls on, obviously, if you just fail the physical or you pass the physical, then that's, more of a black or white area. But sometimes the doctors will indicate that they're able to do the job based on the job description that they got, with the following limitations. And a lot of employers or school districts are not aware that that can trigger the IPM process, just like these other issues that we're talking about. But frequently, you're right, that gets missed in that whole new hiring process, which is complicated. And I will say, I think now it's becoming more of a struggle, to find candidates and to find substitutes and to find people that we need, because there's, so much hiring going on, that I have had requests if we could change our drug test and remove opioids or remove this or remove the things that that they tested positive. But that is our policy, and we do it across the board for everybody. We do tell you, to be fair, that you're going to be drug tested. Most districts, that's their policy, and they tell new candidates that they will be, so they know they're going to be when they go. But
yeah, and I'll just put out for our viewers and listeners too that a lot of people don't realize this, but under the ADA, if an employee files a claim, the employer's liability is actually up to $300,000 on each substantiated claim. And so the cost on the civil side is huge, and sometimes much greater than a workers' compensation case. So if you do use me, you at least get guidance on how to do it so that you can do it in the future. But it's a small investment, particularly under the Zoom guidelines where they're only $500. And that's pretty much across the board. So yeah, hopefully we'll have my webinar format to my training program out soon. Of course, it always takes longer than everything else. And I've been updating the manual that I many purchased already with some of these new COVID guidances because of EEOC's strong role in interpreting that. So I'd just like to, just a couple minutes left here, is if people want to go ahead and open up their mics and ask any questions. We've got a few more minutes to stay on. Any particular questions?
And they can follow up with questions after too, if I know some people have confidential issues, and so sometimes they don't want to share it in a chat format,
Yeah. So just to summarize then, again, feel free to reach out to either myself or Felicia with an email. We will be having a recording sent out to those of you who registered, and I will include the EEOC link there for the webinar that we were provided last week. And, we talked about the implications of AB 95, which was put into effect March 29th, retroactive to January 1st. Through September 30th, providing those additional 80 days, a new bank of hours. And then we talked about the EEOC guidance. And so again, we've got to look at things on a case-by-case basis, even with the COVID and the other state guidelines that we have. So evaluate whether or not someone can realistically continue working from home or not. It's got to be meaningful work again, or think creatively on how you might use your employees in other ways, that there's still something productive that they're doing for you as an employer, but then will again keep them working. And then also how they have defined the direct threat element about vaccination or not vaccination. And as an employer, you have the ability to mandate vaccination if it makes sense for your environment and for the jobs being performed. And then last week, we talked about the implications of drug testing, and that, like so many things, anxiety, depression, alcohol use, substance abuse use is on the rise, or has been on the rise throughout this COVID time. So that does impact the new people you're hiring. And so again, an interactive process would be your best practice to evaluate those implications so that you don't potentially run into compliance issues with many of these laws these days. So that's sort of the gist of what we've covered today on April 19th. And so thank you again, Felicia, for your wisdom and guidance and insight about your experiences. And I hope everyone benefited from our chat today.
It was my pleasure, Deborah. Thank you.
Well, thank you. Well, thank you, everyone. We will see you again in another month. And stay tuned. There's more.